So, in response to the request that we've received on how can I take an x-ray better freehand, we're going to go ahead and give a quick lesson here. I do apologize as I do not have a human test subject today, so I only have my buddy here, Saul the Skull. So I don't have any students in class today, so unfortunately this is just something I'm throwing together last minute. So I will see what I can do as far as a human subject goes later on. But getting back to the task at hand, so freehand, we have a couple different options here. First of all, backtrack a little bit. Freehand wise, if you don't know that this even exists, this is an endo XCP. This is great because the patient can bite down on this and it creates that extra space in the event that you have a file or gutta percha in there. So this is usually my go-to and you can even still use this with the rubber dam. So the endo XCP is my go-to doing root canal therapy. Now, if you're just working in an office, maybe they don't have XCPs for whatever reason, and they want all the assistants to freehand everything. Here's a couple options that we have. Of course, we have the traditional old school lobster claw, and this only fits traditional film, so this particular design would not hold a sensor. Then we have a standalone, just a bar holder. This fits a particular size sensor that you would put in, and usually I would have the patient hold this when taking x-rays. Then, of course, we have the updated Rin holder, and very comparable to the lobster claw. You just put the sensor in there. It has these soft cushions to hold your sensor in place. So once we figure out which x-ray we want to take, so right now, of course, we're set up for maxillary left, mandibular right. Remember, flat surface is going to be towards the tube. The back surface is comprised of, think of the old school x-ray with the lead. That's where the film is going to stop. So in this case, with Saul, if we were taking an x-ray on the maxillary left, the reason why I have Saul out is it's very important that you understand your anatomy. As we know, with the maxillary molars, we have the sinuses, and that's kind of our anatomical landmark to go by. And then there's other landmarks that we can follow as well. So when I'm taking these x-rays on a patient, I'm actually pointing to the tooth, figuring out approximately where the apex is, because of course that's what we want to get in these x-rays. So when we're placing these x-rays, and I'm not having the patient bite down on this, but I'm lining up where that apex is to get the shot. So keep in mind with your tube head, whatever position you angle this at, that's what you want your tube head at. The problem is some people angle and then they come straight on, or they come in too much. And then of course, that's where we can get into foreshortening, cone cutting, and other problems when taking our x-ray. So in this case, I would line up. So let's say we want to take an x-ray on 15. I would center the sensor on 15. Then I would have the patient hold this. Have them stay open. Don't bite down. Patient stays open. Then I come in with the tube head and make sure that that is parallel. So when you're not using an XCP, this falls under the bisecting the angle technique, but we still want to make sure that everything lines up. So we have our sensor, our tooth, and of course, our tube head. So give that a try, and then especially on the mandibular, don't be afraid. A lot of people just want to gingerly put this in there. Don't be afraid to push down. If it's not, usually once I have the sensor lined up, I make sure that it's touching the front teeth. If the patient's lifting, I'm not even going to waste the shot because I know I'm not going to get the apex. So once again, visualize where the apex is to get that x-ray. So I explain to the patient, hey, just hold this here for a second or two. Very important. So I might give it that final push, then take the x-ray. But going back to Alera, do not take an x-ray unless you feel good about it. So we hope this helps today with the quick review on how to take a freehand x-ray. Like I said, whenever I get a live body in here, I'll try this again for better visualization. But for now, Saul helped us out a little bit. If you're not that great at your anatomy, maybe you were trained on a job or maybe you just forgot some of this stuff, we got Saul here on Amazon for a great price. He's great. And of course, he's great for patient education as well. So I'll drop the link below so you can find that, or feel free to contact us in case you want your own Saul the Skull. So we hope everyone has a great day. And of course, we hope this helps. And if you need help with something in particular, please feel free to drop a comment, send a message, and we'll do our best to put something together for you. Thank you.